my two colleagues are going to use after me. They haven't used yet. So I'm going to teach them basically how to use it. I'll help you pull up the cases. But so it's kind of like Osirix. But anyway, so as we're scrolling through this abdominal CT, we can see that there's a mass. Ignore the liver for a minute, but we can see that there's a mass kind of arising from the inferior aspect of the pancreas. There's no pancreatic ductal dilatation and no common bile duct dilation. When this was originally read, though, we thought this was coming from the pancreas and said that maybe this was a necrotic, mildly exophytic pancreatic adenocarcinoma.
It's very common disease.
Yeah.
SMV.
Yeah, good. Get some observations is that it seems to be invading into the vein or involving the vein in some way. And then there was also a number of liver lesions that we thought were concerning for Mets. And then actually, incidentally, there's a nice, for the residents here, there's a nice appearance of a Nissen fundoplication.
No significant region.
So any other thoughts aside from a pancreatic cancer?
Angiosarcoma.
Neuroendocrine.
Okay, good thought. And those can be large and kind of heterogeneous and not necessarily obstruct ducts. And they can also invade the veins. So that's a good thought. Anything else? Yeah, so my colleagues here hadn't seen the case, so they were asking if it maybe could be a sarcoma arising from the vein itself, and that's what it is. It's a portal or a SMV/portal vein leiomyosarcoma, and we got the diagnosis by biopsying the liver. So just to show it here again. So you can see that it's kind of like, you know, it could be invading it, but it also almost looks like it's centered within the wall of the vein itself. So I've seen a few of these, mostly, so just to briefly talk about leiomyosarcomas. They're the second most common soft tissue tumor in the abdomen after liposarcomas. And these leiomyosarcomas usually arise from the smooth muscle of the vein wall. So most commonly it's of the IVC, but it also can be of any other vein. So gonadal vein, renal vein, portal vein. Portal vein is a little bit more rare. This is probably basically of the SMV. But yeah, this was a leiomyosarcoma arising from the wall of the SMV. So a couple of points about leiomyosarcomas. Do you guys know where the most common place they metastasize to? Yeah. So one of the frequent places that sarcomas in general and leiomyosarcomas metastasize is the lungs. So they usually always get at least a chest x-ray, if not a chest CT. And then this one I think probably had a predilection for the liver because it was arising from a vein feeding into the liver. And I guess the point is if you see a big sarcomatous like looking thing and it's involving the IVC, or any other vein, just kind of keep it in the back of your mind that this could be arising from that vessel. The IVC leiomyosarcomas that I've seen have often been exophytic. So they often look like a big mass that's interfacing with the IVC, but they're actually like arising from that wall and kind of growing outside of it. Any questions?